This is the here. What do you say? How do you do? Oh, thank you. My disclosure. So this is my experience since 2010, and you can see I have about 500 for Bankart plus remplissage, arthroscopically, 500 Latarjet. So you think I am a 50-50 guy, so it's wrong. Because if you see my evolution, in orange it is arthroscopic Latarjet, sorry my friend. In blue, open Latarjet before 2010, and yellow, Bankart plus remplissage. So clearly, my evolution now today is since 2016, 95% of my patients take an arthroscopic Latarjet. So I'm not a 50-50 guy. So there are two questions in one. Why Latarjet? So I will show probably the same philosophy than Michael. And why arthroscopic procedure? This is the question. So why Latarjet? The answer, the same question is why not Bankart? Why did I stop Bankart plus remplissage? Just for one reason, the rate of recurrences. The rate of recurrences. And this is the story of arthroscopic Bankart from Morgan to the anchors. The rate of recurrences still is around 10%. 10%. In the same times, you have to know, and you know that the bone block is only less than 3%. So there are publications between 2004 to 2006 with masters, very big guys, with instability, with arthroscopic Bankart. Here is, after 2 years, average, the rate of recurrence is 9%. You think with time, with the technology, you will increase your performance. It's a wrong idea. Look at now, from 2006 to 2009, over experts of the surgery, 13% of recurrences. So it's not because with the time, it's not because the anchors, it's not because the technology, you will not become better than that. This is my personal experience, not only Bankart, but Bankart plus remplissage. And you can see after 1 year in yellow the rate of recurrences, and you can see after 4 years I am with 12% of recurrences. I'm not better than my colleagues. I have to confess that. So this is a surgery work of the French Society in 2013. After 8 years, we follow the patient during 8 years. It's a long way. 25% of recurrences. So the Bankart for me was not a good option, and you can see this meta-analysis with the Latarjet procedure. We have recurrence less than 5%, and this presentation, this meta-analysis show better result with the Latarjet. So this is the reason why I have stopped the Bankart. It's not only because we have bone loss. We have 90% of bone loss with the glenoid, 95% of bone loss with the heel sacs, but we have sometimes bad soft tissue, and when you make a Bankart with bad soft tissue, it cannot work, and you have plastic deformation. And you can see here, for example, a Hagel lesion. What do you do when you have that? The neck of the humerus is on the right. This is a Hagel lesion, so either you open to repair the Hagel onto the humerus side, or you make a Latarjet because it works, but arthroscopically, you cannot make a Bankart, and of course, you will have a failure of this situation. And I think we have more frequently soft tissue deficiency than we can imagine. So the second question, why Latarjet and why not head-and-neck procedure? Yes, for two reasons. Because there is a problem with the iliac crest. First, it's aggressive, it's invasive, and the efficiency. You have lots of publication, biomechanical publication that show that the most important is the hammock effect, the sling effect. And we know because of that, the Latarjet is better, stronger, biomechanically superior to the head-and-neck. So why arthroscopy now? This is very personal. And in 2010, I thought that this was my hypothesis. The time to return to sport could be quicker thanks to an arthroscopic procedure. It was a rule for the cuff tear. So I thought for the Latarjet, maybe it was the same. This is the very beginning of my thinking at this time, my feeling. This is my learning curve. It's published now, and you can see 300 cases. And The mean time at the first patient was 3 hours. The last patient were about 50 minutes, but the average time at this time was between 40 to 50 minutes. And I think, in my experience, after 50 procedure, it was okay to make it routinely. But today, in 2022, now, yesterday I made a Latarjet, it was 35 minutes. So if you do not believe me, it's not my shadow. You can see my VIMS broadcast. 35 minutes is the time I use in routine to make an arthroscopic Latarjet. And I do not operate like Spiderman, Speedy Gonzalez. No, I work very slowly, but if you do not come back at each step, in fact, 35 minutes is enough. What about the positioning? This is my publication, and you see exactly like Tom said, and Bert, the publication. You can see here my first period and my last period, and finally, after 100 procedure, you can have a correct positioning in more than 85% of your cases. And what about my complications? So my first 103 procedure, I had no vascular lesion, one transitory axillary palsy, so without any sequelae, only 3 revisions, that means 2.8%, one infection, one malposition of a screw, and one bone block malposition with needed revision. But no recurrence in these 103 cases, no recurrence. And yes, we know this is a paper of Bert and Tom. We know that with time and experience, the rate of complication will decrease. So if you want to learn, you have to learn, but this is just a decision in your head. Okay, same paper. The Latarjet complication are not specific to the arthroscopy. We have exactly the same complication, either open or arthroscopic, exactly the same. So now, finally, when you have no real scientific point, you talk about economy. Okay, let's talk about economy. There is only one paper, the paper of Pietro Andelli, of course, and Michael showed the same. Yes, but what is very interesting is between the lines. It's always the glass empty, half empty or half full. The last sentence of the abstract is a lack of data prevented evaluation of indirect cost and therefore a cost effectiveness analysis. So it's not clear if you analyze everything. At this time, it was 1,200 more expensive for arthroscopy in Italy, but in France it's not the same. It depends on the country, it depends with time. And we know when the procedure is new, it's very expensive, like the robot. And with time, when it's become very popular, it's become very, not very cheap, but cheaper. So finally, why I perform arthroscopic Latarjet? This is my conclusion. For me, it is the most efficient procedure. So why I don't do this one? Why not making this one? Because it's the most efficient procedure. No more complication, and it's not so much expensive. I think it's not real, and with time it will go for probably cheaper. But I have to confess, and I totally agree with Michael, that today, for me and for my patient, there is no any significant evidence of any clinical advantage to make arthroscopic or open. I have to confess, my hypothesis in 2010 was wrong today. But the problem is, all the publications are with few patients, 100 patients, 50 patients, with a p less than 0.05. Maybe we could go beyond. We need more powerful publication, and maybe we could prove in the future that we have some advantage with the arthroscopic procedure and more than the clinical open. So the Latarjet to try is to adopt it. And finally, I finish with Senec. It's not because things are difficult that one does not dare, but because one does not dare that things are difficult. Okay, thank you, my friends.